Good afternoon, everyone. This is Christina Rosinski from Child Trends, and I'm joined here by my colleague Sarah Catherine Williams. We're delighted to be able to present to you today on the State Fiscal Year 2014 Child Welfare Financing Survey. First, just a little bit of background about Child Trends and who we are. Our mission is to improve the lives and prospects of children and youth by conducting high-quality research and sharing that resulting knowledge with practitioners and policymakers. So, as a result, we are so pleased today to be able to share our work on this Child Welfare Financing Survey, because it does promote our mission by providing you with the most up-to-date information on states' financing, and as a result can help inform discussions about child welfare financing reform. So first, before we get started, I would like to review some logistics for today's webinar. First, we are recording the webinar and we'll be posting it online for viewing later. To ask questions, please submit them via the question box. At the end of the webinar, we will read aloud questions and provide answers to the extent time allows. And we'll follow up with you after the webinar if we're not able to get to your question today. In addition to any content or substance questions that you may have, if you have any technical problems, you can submit questions about those in that question box too. And we do have a staff member who is monitoring those questions throughout the webinar. And finally, you will be muted throughout the webinar. So again, any questions would need to be submitted through that box. So our agenda for today's webinar includes reviewing background about the Child Welfare Financing Survey, presenting key findings, providing a tour of online products related to the survey, having a commentary from Joan Smith at Casey Family Programs and Don Winstead from Don Winstead Consulting, and finally wrapping up with questions. So first, we'll give a little background about the survey itself. The survey is funded by the Annie E. Casey Foundation and Casey Family Programs and is conducted by Child Trends. It extends our biennial tracking since 1996, meaning that this is our the ninth iteration of this survey. The goal is to document the sources and amounts of spending by child welfare agencies across the U.S., and this allows for the documentation of national and state-specific trends, as well as comparisons across states. And this year, we're pleased to report that we got a 100% response rate, meaning we have information on all 52 states, including DC and Puerto Rico. And so this survey collects data on states' expenditures on child welfare activities. And so before we dive in, a little background on what we mean by expenditures and child welfare. So by expenditures, we're referring to all dollars spent for programs, case management, administration, operation of states' child welfare service systems, but not any unspent allocations or appropriated funds. And by child welfare, we mean all the following services administered by the Child Welfare Agency to children and young adults. And you can see on this slide a variety of bullets detailing the different services we mean by child welfare. So now before we really dive in, we have a 3-question poll to better understand who is joining us today. And that will be showing up on your screen. You should see it now. The first question is, which category best describes your job function? So if you could go ahead and respond to that question. We'll give everyone a few seconds to respond there. Now you'll see the second question, our 3-question poll. If you've ever used data from the National Child Welfare Financing Survey in your work, either the current iteration or past iterations that you've seen, whether you've ever used it. And finally, the third question, which should be showing up right now, is how have you used the data? And here you can check all that apply. If you've never used the data before, you can just check that first option. For those who have used the data before, There are 4 response options. All right, great. Thank you, everyone, for doing that. That will be helpful for us moving forward to learn better about not only who joined us today, but also if people have been using the data, and if so, how they've used the data. So now I'm going to move along to provide a summary of the key findings that we are going to present to you today. I'm going to quickly walk through each of these, and then we will go into each one in more depth. So the first key finding is that total child welfare expenditures decreased since 2012. States are spending less federal money and more of their own funds. States spend their federal and state and local dollars in similar ways. And expenditures from most major federal funding sources declined except Title IV-E. And Title IV-E continues to be the largest source of federal funds spent on child welfare, but this varies by state, and we'll get into that more a little later. And now I'm going to hand it over to my colleague, Sarah Catherine Williams, who will walk us through the other 4 key findings.
Great. Hello, everyone. So the last of the 4 key findings, around half of children are eligible for 4E foster care assistance, and slightly over 3/4 are eligible for adoption assistance. 10% of Title IV-E waiver funds were used to support activities not traditionally funded via Title IV-E. States' utilization of flexible funding streams, which are TANF and SSBG, Social Services Block Grant, their utilization varies. And among states using Medicaid for child welfare activities, the most common use is for rehabilitative services.
All right, so key finding 1. Now we're going to go through each one of these in more depth. So key finding 1 is that total spending is down 1% since state fiscal year 2012. This is the second iteration of the survey that found a downward trend. And on this graph, just a little background, the blue bars represent the total amount of spending that has been reported to us each year. But in some years, some states did not participate in the survey, so that in order to make accurate comparisons over time, we overlaid the green line, which represents the total spending by states that were able to report figures in each of the 6 years presented on this graph. So that green line is really represents the comparable data. And as you can see there with that green line, when you compare 2004 to 2014 among the states with comparable data, we see a 5% decrease in overall child welfare spending over the decade. Now, despite that overall 1% decrease in child welfare spending between state fiscal year 2012 and 2014, states varied widely in the magnitude and direction of changes in their spending. In this graph, we show this variation. So the green states here are those that increased their spending, while blue states are those that decreased their spending. Of the 48 states that had sufficient data in both state fiscal year 2012 and 2014, 23 of them reported a decrease and 25 reported an increase in child welfare expenditures, so about half and half. And the decreases ranged from a less than 1% decrease to a 58% decrease, and the increases ranged from less than 1% to a 27% increase. So again, the direction and magnitude does vary depending on which state you are looking at. So this decrease in spending begs the question of why. Why did child welfare spending decrease slightly from 2012 to 2014? So federal data show that in 2014, fewer children received prevention services than in 2012. Children spent less time in foster care on average than in 2012. And fewer children were adopted with public child welfare agency involvement than in 2012. But we also know that compared to 2012, there were more children investigated for alleged maltreatment, more children determined to be victims of abuse and neglect, more children in foster care. And in previous years, expenditures routinely increased in times of foster care caseload decreases. So caseload changes don't tell the whole story and can't account alone for changes in expenditures. So if it's not caseload sizes explaining the decrease, what might explain it? So here are some ideas that we put forth. One possibility is that placement costs could be decreasing. We see in the data that fewer children are in congregate care placements in 2014 than in 2012, and more children were placed in relative foster homes in 2014, and those homes could be less expensive than homes with non-relatives. There could also be changes or reductions in foster care provider rates or treatment provider rates. It could be that economic conditions in states contributed to reduced public expenditures. This could also, part of this could be increased competition for federal sources that aren't solely dedicated to child welfare, such as TANF and SSBG. And it could also be that states are spending less on quote-unquote front-end services like prevention or family preservation. And finally, sequestration could have also played a role and helped contribute to this decrease in child welfare agency spending. And we'll circle back to that a bit later.
All right, so our second key finding is that states are spending less federal money and more of their own funds. The decrease in total expenditures was driven by a 3% decrease in the use of federal funding since 2012. And federal funds spent on child welfare activities have decreased 16% since 2004. The federal funding structure is pretty complex, and several factors contribute to states spending fewer federal funds, many of which Christina just mentioned. Additionally, the eligibility criteria for the largest dedicated funding source, which is Title IV-E, remain tied to 1996 poverty levels, which becomes more limiting with each passing year. This decrease in the proportion of federal funds means that states are spending more of their own funds. While state and local funds spent on child welfare services increased only slightly since 2012, about a less than 1% increase, they have increased by 4% since 2004 over the last decade. The proportion of total child welfare funds coming from state and local sources also increased during that time, from 53% in 2004 to 57% in 2014. While the previous slide showed the split between federal and state and local funds nationally, this slide shows the great deal of variation in how individual states finance their child welfare systems. And that's a word you'll hear a lot today, is variation. Varies by state. So this is a snapshot of a few states here just to kind of give you an idea of the variation. The slide was too small to show you a chart with all of the states. But to put things into perspective, the range of the proportion of federal spending goes from 18% in Puerto Rico to 84% in West Virginia. So it's a pretty big difference. So that's just kind of to give you an example.
Great. So we also requested detail this year on how states are spending their funds in child welfare. So key finding 3 is that states spend their federal and state and local dollars in similar ways. And so for 2014, states reported spending approximately half of all funds, so that's federal and state and local combined, on out-of-home placement costs in the form of, this means in the form of foster care payments, case management activities for children in foster care, and reunification services for children in foster care and their parents. States also reported spending almost 20% of their federal funds on adoption and guardianship supports. And this is notable as the adoption and guardianship category represents services provided post-permanency. Notably, only 15 to 17% of total funds spent by child welfare agencies in 2014 went towards in-home services designed to prevent child abuse and neglect. It is also notable that only about 2% of the funds were spent on services and assistance for older youth. I should note here that this doesn't include maintenance payments for older youth. Those maintenance payments are included in the out-of-home placement category. So overall, states appear to spend their federal and state and local dollars in similar ways, although state and local funds were used more for prevention services and less for adoption and legal guardianship than federal dollars. One caveat here, though, is that it's important to consider that several states were unable to report to us how they use their funds, and some states that were able to report it were only able to determine how they spend their funds overall, not how they spend their federal funds versus their state and local funds. So we expect that future surveys will shed more light on the uses of these dollars.
Our fourth key finding is that expenditures from most major federal funding sources declined, except for Title IV-E, which saw a 2% increase. The Social Services Block Grant SSBG saw the largest decrease of 17%, followed by Medicaid at 10%. And I should note here that for the purposes of this survey, we asked states to report only those Medicaid funds which covered costs borne by the Child Welfare Agency, and it excludes Medicaid-funded costs for the child welfare population that were borne by any other agency. So, for example, the health department. As you can see in how we split up this chart, sequestration has impacted federal child welfare financing sources. The decrease in total federal expenditures was driven by substantial decreases in funding from 3 federal sources, 2 of which were affected by sequestration in federal fiscal year 2014, which was Title IV-B and SSBG. It's worth mentioning that these 2 federal sources represent some of the most flexible funds available to child welfare agencies, so cuts to these funding streams can have a profound impact on the service array provided by states. As you can see in this graph, our 5th key finding is that Title IV-E has consistently been the largest source of federal funds over the past decade. In 2014, the second largest was TANF, followed by Social Services Block Grant. And again, here's our favorite word of the webinar, variation. While Title IV-E is the largest source nationally, there's a great deal of variation among states and how they rely on the different federal funding sources. For example, IV-E only makes up 38% of Michigan's federal funds spent on child welfare services. Most of their federal spending is from TANF. But you can also see that many of these states here don't use Medicaid at all or very little, while other states like Tennessee use Medicaid for for a little over half of their federal child welfare agency spending.
So key finding 6 is that around half of children are eligible for Title IV-E foster care assistance, and slightly over 3/4 are eligible for IV-E adoption assistance. And so to determine these coverage rates for the foster care side, we asked states to report the total number of children in care during 2014 who were determined to be eligible for IV-E foster care maintenance payments and for whom the state claimed IV-E foster care maintenance reimbursement. So that's the numerator. The denominator there, we divided that by the total number of children in care during 2014. And to calculate the adoption coverage rate, we took a similar approach. We asked states to report the total number of children receiving adoption subsidy payments during 2014 that the state claimed IV-E funds as a reimbursement, and divided that by the total number of children receiving adoption subsidy payments that year. And these figures do represent a downward trend over time, coverage rates dropping. But I should mention that we did alter our methodology and how we calculate these rates over time to refine and improve them and make them more comparable across states. So solid comparisons over time aren't possible, but the calculations that we have come up with suggest a downward trend, but the confidence in that trend is rather weak, since we can't be sure given the methodology changes over time. Now again, variation, going back to that. So the previous slide showed those national coverage rates, but here you can see there is wide variation in the coverage rates by state. On the foster care side, you can see some coverage rates as low as the 0 to 20% bucket, and on the adoption coverage rate side, there are some states in the 81 to 100% bucket. I should note here that we did exclude Puerto Rico from these graphs due to their unique status as a territory, but if you're interested, Puerto Rico did report a 0% coverage rate for adoption, since they had no adoption assistance claims in 2014.
Okay. Key finding 7 is that 10% of 4E waiver funds were used to support activities not traditionally funded under 4E. To get at this finding, we asked states to report how they spent their waiver funds on 4 different types of expenditures. So we have costs that would have been reimbursed without the waiver, and these are costs for 4E eligible children to receive 4E eligible services. Costs for 4E eligible activities for children who would not qualify for 4E under traditional eligibility criteria. The third category was costs for services and activities falling outside of traditional 4E eligible categories for any child, regardless of their 4E eligibility. And then the last bucket was for project development and evaluation costs mandated by participation in the waiver project. So in spite of the flexibility allowed under waivers, which many believe is the most valuable feature and allows states to serve as laboratories for new funding and service arrangements, states only use 9% under $100 million to cover costs outside the scope of traditional 4E services. States reported paying for such activities as prevention services, parenting services, kinship supports, and treatment or therapy for children and families with these funds. Of the 18 states reporting waiver expenditures, 11 spent some waiver dollars on services and activities that are not eligible for traditional 4E reimbursement. What is not captured in the federal Title 4E waiver picture, however, are the possible benefits to the state child welfare financing system as a whole. Even in states that are using a waiver to fund only 4E eligible services and activities for non-4E eligible children, other dollars that would have gone to cover those costs for non-4E eligible children are presumably freed up and might be available to be used in more innovative ways. So the remaining 90% were spent on activities such as maintenance payments and caseworker activities on behalf of children in care that would be permitted even without a waiver. However, states did use almost 1/3 of the waiver funds, at 32%, on activities for children who, without the waiver, would not have been eligible for Title 4E support due to income, placement type, or how they came into foster care. With the waivers currently set to expire after the current round, which ends in 2019, states will have to find other ways to cover those services.
All right, so key finding 8 is that states' utilization of flexible funding streams varies. So certain federal sources, specifically SSBG and TANF, give states relatively broad discretion in the kind of child welfare activities that can be funded. Utilization of these funding streams for child welfare purposes varies by state. In 2014, TANF expenditures decreased by 3%, and as you can see on this graph, 12 states did not use TANF at all in state fiscal year 2014, while in one state, TANF represented 76% of the federal funds used by the Child Welfare Agency, and that state is Wyoming. We also continue to explore this year reported uses of TANF and SSBG funds. And given the greater flexibility in the use of these sources compared to other federal sources like Title 4E, we speculated that states were using TANF and SSBG to support non-foster care services such as prevention and post-permanency services. However, when we asked this question in the state fiscal year 2012 survey, we actually didn't find that to be the case. Instead, we found that the top 3 uses of these funds were for the quote-unquote core child welfare activities of foster care, protective services, and administrative costs. And this year, while it remains clear that states continue to use these funds to finance core child welfare functions, the top 3 uses of these funds also included family preservation services for TANF, as you can see on this slide. And these are services provided to families to help children remain in or return to their homes. And now in terms of SSBG, in 2014, this funding source, expenditures through this funding source decreased by 17%, and states, again, varied widely in their use of the source. As you can see here, 3 states did not use SSBG in 2014, and in one jurisdiction, Puerto Rico, SSBG represented 58% of the federal funds used by the Child Welfare Agency. And now this chart shows the top uses of SSBG. And as you can see here, prevention and intervention services are in the top 3 this year. These are services to prevent or intervene in cases of maltreatment and family violence. And so the family preservation services for TANF and now the prevention services for SSBG, they both do not receive significant amounts of funding from other federal sources. So it's interesting that these services made the top 3 this year for these 2 more flexible funding streams.
All right, so our final key finding is that 39 states reported using Medicaid for child welfare services in 2014, and the most common use was for rehabilitative services. When comparing these categories to 2012, we found that more states are using Medicaid for services for children in treatment foster homes, and fewer states are using Medicaid for targeted case management. Our final findings. We wanted to say thank you again for joining us today. Before we go on to questions and final remarks, I wanted to show you where you can access more information about the survey, which is on the Child Trends website. I'll give you a quick tour. We created a whole suite of resources this year, which are new. So once you get to the Child Trends website, please feel free to subscribe to our listserv. And if you click, hover on the research tab and research by topic, child maltreatment and child welfare, this report is one of our featured research publications. So it's the Child Welfare Financing Survey of 2014. We have the main report here. You can download this publication. And then for other project resources, we have the full report. We have a 1-page, 2 or 3-page national overview. We also have a state-level data table where you can find additional information about your state. That's in an Excel document. We also have fact sheets by funding source. So we have Medicaid, other federal funds, just going through all the different funding sources. And then we each have something that we're really excited this year about is that we have these funding by state sheets. So every state that participated, which was every state in DC and Puerto Rico this year, available here. This is also where you will find a recording of the webinar and the PowerPoint, and that'll be available in about 24 hours. So we'll get that up for you guys. So that's where you can go for more additional information.
Great. Thanks, Sarah Catherine. So now we're going to turn it over to Joan Smith from Casey Family Programs, which is one of our funders for this survey, and Don Winstead, one of our advisors, to provide some thoughts. So Joan and Don, over to you.
Thanks. So this is Joan Smith, and I'm Managing Director at Casey Family Programs in our Systems Improvement area. And I just wanted to, first of all, thank Child Trends for the work that they've done over the years and being able to collect this information. I believe that it is the only source of a comprehensive piece of information around how child welfare is financed. I think there are different places we can all look for different pieces of this information, but putting it all together in such a way that Child Trends has done has been extremely helpful in terms of looking at how we finance the child welfare system overall to help then guide us in terms of any changes that we think we might need to make in that financing structure and or ways we want to advocate for resources in that structure. So first of all, kudos to all of you at Child Trends for putting this together, and thank you for all of the states for being willing and participating in the survey every 2 years. It's so important, the information that you provide, to be able to have that body of information to continue to move it forward. And our goal at Casey is really to be able to make sure that we're working with Child Trends to have the information as usable as possible for each of you so that it is helpful to you in your daily operations and how you advocate with your legislatures and others to finance and support the child welfare system. So any feedback you have related to that, please feel free to send that in through your strategic consultants or to me directly at Casey Family Programs to make sure that we're doing the best that we can to support you in that effort. As folks know, Don is a premier expert in child welfare financing and among other things in child welfare, and I'll just let him talk a little bit from his experience because I think he captures it well.
Right. Thank you very much, Joan. And one of the things that I really appreciate about the survey and having that information is working with Casey Family Programs and with a number of state and local jurisdictions. I've had the pleasure of working with a lot of programs on issues particularly related to funding and how that can be used to improve program practice. And as Joan said, the Child Trend Survey is really the only source of information that takes all of the different funding sources and brings it together in one place. And then by having the longitudinal perspective, we can look from survey to survey and see how things are trending and not. I think one of the things that our colleagues from Child Trends emphasized is the variation among states, and this is certainly something that I think we see over and over and over again. And for people who are with a particular state or county and kind of come up through that system, there's a tendency to think that how we do things in our area is pretty much how everybody does it, and we use a lot of the same terms, and it sounds very similar. But when you look at things from a financing perspective, you see that it's not consistent at all. States are very different one from another, and the differences extend much beyond things like whether it's a county-operated system or a state-operated system, etc. How states use funds and how they make use of particularly of the funds that have flexibility to be used in a variety of areas is extremely varied, and I think the survey really shows that. So people who are seeking to understand overall how child welfare systems work really can benefit by that perspective of how rich the variety is from place to place. I think it's also extremely useful if you're in a particular state or county and you're wondering how can I learn from others, then it really points you in some directions, so that if your state is interested in seeing how can we more effectively use Medicaid to serve children and families in child welfare, then you have some places to look to where they're doing a lot of that work. And so there's I think a tremendous benefit in seeing the variety and the perspective, the comprehensive perspective that is shown in the survey. A couple of things I wanted to mention particularly. One, and here I'll offer a little bit, I guess, maybe a contrasting perspective on the waiver findings, because I've had an opportunity, as has Joan, through Casey Family Programs, with working with most of the waiver jurisdictions. And I do think it's important to emphasize that 32% number that was reported of 4E waiver funds used for 4E eligible services for non-4E eligible children. And these are services or, whether it's maintenance or case management or whatever, that without a waiver have to be funded out of either state or local resources or other applicable funds. But once you're under a waiver, one of the requirements in all of the terms and conditions for the state waivers is that any savings, whether those savings are federal funds, state or local or other funds, have to be used for the further provision of child welfare services. So in many jurisdictions, using those waiver funds for traditional 4E services for non-eligible children essentially results in a fund shift, so frees up some increased state or local funds. So I think the impact there is pretty substantial, and then when you add the other 9% in, you have a pretty significant commitment of funds there. And of course, this was the 2014 survey where some of the states were still in their very initial implementation phases, or in a couple of cases hadn't implemented yet at all. So I think this is something we're going to be real interested to see in the next survey, how those numbers develop, and it has a lot of implications with the statutory end of waivers of how states look at that overall. But looking overall at the survey, it just, to me, the most significant thing is it gives us a very good window into information that just wouldn't be available otherwise. And in terms of our ability to monitor and help guide program performance, I think it's a unique resource and one that is invaluable.
Well, thank you guys very much. Since we're good on time, I wanted to go back real quickly before we go on to questions and take the opportunity to give you a preview of the fact sheets. I have to say, these are kind of my babies, so I'm really excited about them and proud of them. Like I said, this is something new that we did this year, and we want to encourage you to make use of them. I'll show you the Georgia one because I'm from Georgia, so all examples that I give are from Georgia. Let's see, we'll download this one. These are all available in PDF form. Takes a moment for it to come up. Overview of the survey and a little more information about what the document presents, and it goes through different different topics. We start off with the change from state fiscal year 2012, and then go through the split of federal, state, and local spending, break out federal expenditures by state. We show trends in spending in terms of Title IV-E, foster care and adoption coverage rates, and then we go through all the other federal funding sources with the total amount spent during 2014, and then the change from 2012. That's just one example of the state level one. And then I'll show you just a quick snap fact sheet. This one is by Medicaid, or for Medicaid. So again, some additional background information, and then we go through overall spending over the decade, utilization across states, so we have one of these for each of the major federal funding sources, as well as state and local funds. So that's just our preview, and we will now go on to questions.
So our colleague Carrie DeVoe has been monitoring questions for us. Carrie, have any questions come in?
Yeah, hi everybody. Again, I'm Carrie DeVoe. I'm a senior research scientist at Child Trends, and as Christina said, I've just been keeping an eye on the question box as they've been coming in through the session, and I'd like to read just a few out loud. And if we haven't been able to respond to you during the session, we will definitely follow up with you, and feel free to add any additional questions in the last few minutes that we have here too, or to follow up with us afterwards. But several people had asked if the slides were going to be available for download, and the answer is yes, they definitely will. The webinar recording and a PDF of the PowerPoint will be on the Child Trends website within the next 24 hours, and we're going to send all the attendees an email later that has a link to that page following the webinar, and so you'll be able to get the resources, both the recording and the PowerPoint. We also got another question about whether the amounts were adjusted for inflation when we talked about doing comparisons between the years. And apologies if that wasn't noted at the beginning, because yes, inflation is definitely taken into account, and anytime that we referenced a comparison between 2 or more years, we had inflated the dollar amounts from the previous years to allow us to do an accurate comparison. And then the third question I wanted to raise, somebody asked about the states that were unable to report their spending patterns. Did they explain why they were unable to do so? And I believe that this is referring to our question on the survey about how the federal and then the state and local dollars were spent in terms of the percentage spent on out-of-home placements versus in-home services, et cetera. And this may be a detail that you'd need to look into, Christina, in order to follow up, and we'd certainly follow up after the session. But wanted to know if you did have a sense of whether these states described why they weren't able to provide this, or even Don, if you have a sense of why this might be a challenging categorization or breakdown for some states who were unable to do so.
Yeah, this is Christina. I can take that one first. So I do recall that several states, when they said that they were unable to report that breakdown on how they spent their funds, a lot of them mentioned that it was due to the way that their accounting systems are set up. It's just their accounting systems aren't configured in a way that would allow them to relatively easily pull out how much was spent on out-of-home placement versus how much was spent on adoption and guardianship. It would just be a very, very heavy lift for them to do it that way. Other states didn't cite the same problems, so it's probably very dependent on the accounting systems that each state uses. But Don, I'd be interested to hear if you have any additional insights into why that might be particularly challenging for states. We're unmuting you right now. So.
Yeah, I agree with you. My sense from working with a number of states is that the states are in very different places with their sophistication of their accounting systems, and in some cases that's a barrier. And hopefully that will just get better over time, but also there's some parts of it, so states may have the information for 4E because the federal reports that states have to fill out are getting increasingly detailed with 4E with the modifications that have been made to those reports. But there may be some of the other sources that are less detailed, and there were changes to some additional changes to the 4E reporting in 2014. There were additional details added to the TANF financial reports, etc. So I think that going forward, hopefully states are increasingly able to tease that out because they're going to need to get that information out of their systems to be able to properly fill out the new financial reports from the feds. But it's the accounting systems and the differences in how they're able to tease information out of those.
Great, thank you, Don. I think we have time for just a couple more questions that have come in. Christina or Sarah Catherine, can you tell folks what's included in the term rehabilitative services when we discuss that in the context of the Medicaid findings?
Yes. Hold on one second. Let me get back to those notes.
I can actually jump in.
Yeah, can tell you more clearly than I can.
Yep. So the rehabilitative services that we presented earlier in the context of Medicaid, it really refers to the treatment aspects of broader services that a shelf agency may provide. So, for example, it could include intake and assessment. It could include counseling and therapy, crisis intervention, and these can all be provided within the context of non-medical residential and group care settings, therapeutic foster care. So it's those treatment aspects of the services provided within those broader, not necessarily treatment-based placement settings.
Great, thank you, Christina. And then Don, there's one more for you here. Somebody asked that you referred to the association of funding typology with program performance, and they'd love to hear some examples of how this plays out, if you have any to share.
Well, yeah, I think funding is basically, I think of the funding as sort of the gas in the tank, and the more a state can tease out flexibility out of the way they array their funds, then the more options they have. So, if I'm intervening with a particular family, then the type of, in some places, essentially the funds available are going to dictate the services that I can provide because of restrictions with the funds, so that if I can array my funds to give me more options, then the protective investigator or the child's case manager or family case manager may have a wider array of options in terms of service interventions that they can bring to bear to serve the child, to serve the family. So I think that how you array your funds are going to translate into how effectively you can have your services meet the needs of the individual children and families that you're working with.
Okay. Well, a couple of other questions have come in while we've been chatting here, and some of them look a little bit specific in the sense that I think we need to check back on our data file to make sure that we're giving you accurate information, but we will follow up, as I said, with everybody who has submitted a question and make sure we get you the information that you needed. But I wanted to just provide a little bit of a request or some comments here at the end that as we're preparing for the next round of the survey, we really, really do welcome and want to hear from people who use these data, or if you haven't used these data in the past, if you want to use these data. Are there things that we haven't collected that would be helpful to you in your work, or are there analyses or calculations that you haven't seen in our reports before that would be useful? And we're always trying to make products out of this survey that are the most user-friendly for the audience who needs them. So once you have a chance to kind of poke around on our website and see what we've done this year, we have those new state-specific fact sheets and the topic-specific fact sheets. Feedback is so very welcome. Please let us know what you think of these, if these type of resources are useful and we should do them again, and how we can better tailor things to your needs so that you can communicate about these data. We definitely understand that this is a complex topic, so we're trying to build tools for the field that make it as clear and as understandable as possible. So I know that Sarah Catherine and Christina have their email addresses up on the screen there, and please feel free to use them with any feedback that you have. So I think I'll turn this back over to Christina to close things out. Thanks, everyone.
Okay, great. Thanks, Carrie, and thanks for everyone else for participating in today's webinar. We hope you found it informative, and just reiterating what Carrie had said, if you have